Two headlines suggest that Obamacare is unraveling 3 years after it became law. Number one, the Senate overwhelmingly votes to repeal the medical device tax that helps fund Obamacare. Number two, health insurers say premiums could double for some people next year. Our next guest wrote the book, Beating Obamacare. Betsy McCaughey is here. Okay, I know what your answer is going to be. Are we stuck with Obamacare?
No, but we're going to feel the pain before voters go to the polls and stop this moving train.
Right, full implementation. January the 1st, 2014.
It's already
It's going to happen, isn't it?
Obamacare is rolling out with a vengeance. You already see it in the hospitals. Cuts to Medicare pay for over half this law, including big cuts to what hospitals are paid, $247 billion less money over this decade. They're already laying off nurses. And brace yourself for the decline in care. People are already seeing fewer nurses on the floor, longer waits when you press that button for help.
So I'm stuck with it. I mean, I am. I mean, through all of next year, I've got this thing around my neck.
Yes, but let me point out what's going to happen. Skyrocketing premiums, many people, millions of people losing their on-the-job coverage.
I got it. But how do we unstuck ourselves?
Okay, so voters are going to go to the polls in the midterm elections in 2014, and they're going to pull that lever against Obamacare. They're going to vote for members of Congress and the U.S. Senate who are committed to defunding it.
Too late. It's too late.
No, it is not too late.
The exchanges will be in place. The taxes are in place. The nurses are out.
The taxes can be repealed. The insurance companies still exist. The physicians still exist. The hospitals still exist. And the exchanges, they aren't really going to be ready anyway.
But then you've got a huge mess. And any attempt to unravel what is already in place would be a huge mess.
Not at all. In fact, it's highly feasible, and it will save our health care system. The Republicans have a shot at gaining at least 6 seats. That's all they need to win control. There are going to be 33 Senate seats in play. The Republican seats are safe. Of the currently democratically held seats, 13 of them are in swing states or red states, right. Republican states.
So your hope is a political revolt.
There will be a political revolt.
Charles.
This is the thing. We had this discussion a few times last week, and Stuart's point to me is once you give somebody something free, you can't take it back. By the time the midterms roll around, will it be too late to get the notion out of their heads? And the majority of voters that we're going to take something away from you that's free, but not good for you.
But a majority of voters are not getting anything for free. Free. There is no tooth fairy. A small number of people, let's say 60 million people, will be getting something of a subsidy, right? The other Americans are paying up front in terms of job security, much higher premiums, and a lower standard of care in the hospital. They are going to go to the polls and say, forget free, we want a high-quality health care system.
We've got 30 seconds left. You've got an email.
That's right. I got an email from Tom in California. He works in a county sheriff's office, and he was just told this week that he's losing his full-time job. He can only work 24 hours a week. They're hiring another part-timer to do the other half of his job. He says, I have kids to send to college. They said go on unemployment.
That's because of Obamacare?
This is a county government, yes. Right. They said specifically because of the Obama health law. Employers with 50 or more full-time workers have to provide coverage. They don't want to cover him.
All right. I can tell you've read this thing because you bring that every time. That's what, right. £17 item.
2014 will be a referendum on the Obama health law.
Betsy McCaughey, you said it right here. Thank you very much indeed.
Thank you.
Good stuff.